I would like to call the Finance, Ways, and Means Committee to order for March 24th, 2026. Madam Clerk, please open the board for roll call. Members, please be sure that you are signed in so that we can take the roll. Members, please be sure to sign in. Has everyone signed in? Does anyone need more time? Madam Clerk, please take the roll.
Mr. Chairman, you have 26 members present. You have a quorum.
All right, thank you very much. Members, any personal orders or announcements? Hearing none and seeing none, we do have a total of 7 bills on the calendar, as well as a presentation by the Department of Finance Administration, and we are going to take up the bills first. So let's begin with item number 1 on our calendar. It's going to be House Bill 484 by Representative Capley. You have a motion and a second. Sir, you do have an amendment drafting code 014976. Is that correct?
Yes, sir. Thank you, Mr. Chairman. Yes, sir.
All right, it does rewrite the bill. So members, any discussion on, we do have a motion to second on the amendment. Is that correct? We have a motion to second. Any discussion on the amendment? Hearing none, seeing none. We're now voting on drafting code 014976 on the House Bill 484. All those in favor signify by saying aye. Aye. All those opposed, no. The ayes have it. We're back when the bill is amended. And Representative Capley, you're recognized.
Thank you, Mr. Chairman. Members, I am carrying this for Brother Brock Martin, and they had their baby son today. Want to report they're doing well. Mom and baby are good. So that's it. That's all I got.
All right. All right. Question has been called on the bill. So any objection to calling the question? Hearing none, seeing none. Madam Clerk, please open the board. All those in favor of House Bill 484 moving on to calendar and rules, please vote aye. All those opposed, please vote no. Has everyone voted? Would anyone like to change their vote? Madam Clerk, please take the vote.
Mr. Chairman, you have 26 ayes, 1 no.
All right, thank you. The ayes have it. House Bill 484 moves on to calendar and rules. All right, that brings us to item number 2. Item number 2 on our calendar is going to be House Bill 1820 by Chairman Russell. You have a motion to second, sir. You're recognized.
Thank you, Mr. Chairman. I have Amendment 13473.
It is traveling. You are in the proper posture.
Thank you, Mr. Chairman. Committee. House Bill 1820 would require a person to have graduated a post-certified law enforcement academy to run for constable in January or in 2030. It also expands their professional certified candidates' mental and cognitive functions for a constable. It changes it from the original psychological we passed a couple years ago to a law enforcement psychological. This sort of corrects the law.
All right. Thank you, Representative. Members, you've heard the description. Any discussion? Again, we're on House Bill 1820. Hearing none and seeing none, are we ready to vote? Madam Clerk, please open the board. All those in favor of House Bill 1820 moving on to calendar and rules, please signify by voting aye. All those opposed, no. Has everyone voted?
Green button.
Would anyone like to change their vote? Madam Clerk, please take the vote.
Mr. Chairman, you have 27 ayes, 0 no's.
The ayes have it. House Bill 1820 moves on to calendar and rules.
Thank you.
Thank you. That brings us to item number 3. Item number 3 on our calendar is going to be House Bill 2215 by Representative Atchley. You have a motion and a second. Sir, you're recognized.
Thank you, Mr. Chairman. This bill was brought by the cities of Gatlinburg and Pigeon Forge. It allows TWRA to enter into agreements with local law enforcement agencies with the limited purpose of enforcing the prohibition of the intentional feeding of bears and increases the violation from a Class C to a Class B misdemeanor, increasing the penalty from $50 to $250. That's what this bill does.
All right. Thank you very much, Representative Ashley. Let me just make sure, did we get a motion and a second on that? We got a motion and a second. Thank you for the description. Let's go to Chairman Vaughn. You're recognized.
Thank you, Mr. Chairman. I would like to request that we call the question on this bill.
All right. Question has been called. Objection called on the question. Hearing none, seeing none. Madam Clerk, please open the board. All those in favor of House Bill 2215 moving on to calendar and rules, please signify by voting aye. All those opposed, please vote no. Has everyone voted? Would anyone like to change their vote? Madam Clerk, take the vote.
Mr. Chairman, you have 27 ayes, 0 noes.
The ayes have it. House Bill 2215 moves on to calendar and rules.
Thank you, Mr. Chairman. Committee.
Thank you. That brings us to item number 4. Item number 4 is going to be House Bill 2186 by Leader Lamberth. You have a motion and a second. Sir, you're recognized.
Thank you, Mr. Chairman. I stand ready for questions.
All right, you've heard the somewhat description. Any discussion? Are we ready to vote? Representative Love.
Thank you, Mr. Chairman, to the sponsor. So this will apply to, is it 2 locations in the state?
Leader Lamberth.
The bill applies to all metro and city governments. The top half, as we discussed, would allow for metros to be able to reduce their grocery tax. The bottom half just eliminates some of the unnecessary language that was in the code.
Representative Love.
Right, thank you. And so it's what we have 2 in the state, or right now we have 2, but going forward could apply to more if they consolidated, correct?
Leader Lamberth.
It's any county with a metropolitan form of government. And if you're asking about section 1,
Yes, where it says the bill authorizes a county with a metropolitan form of government.
Leader Lamberth.
that's correct. I'm going to stick with the words on the page.
Representative Love.
And I guess, Mr. Chairman, I'm asking, so it'll apply to the current ones we have and any in the future who may become metropolitan forms, correct?
Leader Lamberth.
Yes.
Representative
Thank you.
Love.
Thank you, Mr. Chairman.
Thank you. Next on the list, Speaker Zachary, you're recognized.
Thank you, Mr. Chairman. Question on the bill.
Question has been called. Objection called on the question. Hearing none and seeing none. Are you ready to vote? We're now voting on House Bill 2186, moving on to calendar and rules. Madam Clerk, please open the board. All those in favor, please signify by voting aye. All those opposed, please vote no. Has everyone voted? Would anyone like to change their vote? Madam Clerk, please take the vote.
Mr. Chairman, you have 24 ayes, 3 noes.
The ayes have it. House Bill 2186 moves on to calendar and rules. Thank you, Leader. Next is item number 5 on our calendar. It's going to be House Bill 1628 by Representative Capley. We have a motion and a second. Sir, you're recognized for a brief description.
Thank you, Mr. Chairman. Thank you, committee. This is an admin bill that makes updates to the Department of Tourism and Development. That's what it does.
All right, thank you for this description. Members, any discussion? Again, we're on House Bill 1628. Hearing none and seeing none, are you ready to vote? Madam Clerk, please open the board. All those in favor of House Bill 1628 moving on to calendar and rules, please vote yes. All those opposed, please vote no. Has everyone voted? Would anyone like to change their vote? Madam Clerk, please take the vote.
Mr. Chairman, you have 27 ayes, 0 noes.
The ayes have it. House Bill 1628 moves on to calendar and rules.
Thank you. Appreciate it.
Thank you. That brings us to item number 6. Item number 6 on our calendar is going to be House Bill 819 by Representative Garrett. You have a motion to second. And we do have an amendment. We will run drafting code 016115.
Second.
Okay, we have a motion and a second on that one. Leader or Representative Garrett, do you want to put this one on? Give me just 1 second here.
I don't show that as the amendment that we adopted in subcommittee.
We actually combined that. We
So
combined.
there's a new drafting code. for
Yes,
that.
sir. That
All right,
is
so
the new
that one
drafting
has the
code.
new drafting code of what was it?
I have 016115.
I'm going to trust that is the bill that was passed out of subcommittee. I don't have that particular drafting code,
Yeah.
but if that's the one we rolled in together,
Let me give you the
Mr.
two that it does combine, just so that everyone knows. It does combine 015819 and 015966.
perfect. Thank you, Mr. Chairman. That is the correct drafting code.
All righty.
And yes, I'd like to move that amendment.
Okay. Members, we have a motion to second. Any discussion on the amendment? Hearing none, seeing none, we're now voting on amendment drafting code 016115 on the House Bill 819. All those in favor signify by saying aye. Aye. All those opposed, no. The ayes do have it. We're back on the bills amended. And that brings us to, we have another amendment that was filed. This will be amendment, this is by Chairman Williams. This will be amendment 015741. Is that correct? All right, we have a motion to second on the amendment. We have a motion second, sir. You're recognized on the amendment.
Thank you, Chairman and members. First of all, this amendment has a drafting error that is completely my fault because I got confused about Jackson County and Madison County. The untimely filed amendment, which we can't consider today, makes that correction. So that's the amendment I'm actually going to be talking about, even though we can't talk about it. So what this bill would do, what this amendment would do, it would prevent the removal of CON in the three counties that had a concern regarding CON: Murray County, Madison County, and Putnam County. It's kind of an effort to protect those rural healthcare facilities, one of which is in my county, in Putnam County, and quite frankly, just stirred the buzzards off the carcass at this point. But I appreciate the work that Representative Garrett has done. This bill has been moving quickly. I do think the amendment that the speaker had was good. The big challenge that I've always said as it relates to licensure, of moving or eliminating CON to licensure, is payer mix. Payer mix means everything. Large hospital chains are able to get reimbursed. We heard from Chairman Howell yesterday. Large hospital chains are able to get reimbursed sometimes 20, 25% more than rural hospitals, which gives them an unfair advantage, particularly with private pay or with public pay through TennCare Medicaid. Hopefully we'll be able to fix that before the clock runs out on our local rural hospitals, because this will be transformational. Thank you. Chairman, move to withdraw.
All right. We do have a request to withdraw without objection. So moved. We're back on the bills amended. Representative Garrett, you're recognized.
Thank you, Mr. Chairman, and I want to appreciate Chairman Williams' hard work on this, his dedication to his district. Hopefully, this will be touched for many years to come. We've been trying to eliminate several different areas of healthcare from CON, and this is a good start, and I hope we continue to do that, as I do believe market principles are best, especially as it relates to our healthcare. So what this does is basically three things. It removes acute care hospitals from CON beginning 2030. It also removes freestanding ERs and heart caths from CON by 2027, with some exceptions. We are accepting out a facility that's actually located in East Tennessee that just got up and running. It does not apply to them. So with that, Mr. Chairman, I'll be happy to take any questions, but I believe this piece of legislation has traveled quite a bit, has been worked quite well, but I am happy to answer any questions we can in order to hopefully pass this out today so we can eliminate the bulk of certificate of need. With that, Mr. Chairman, glad to take any questions.
All right. Thank you very much. Members, you've heard the description of House Bill 819. Any discussion? Leader Camper, you're recognized.
Thank you, Mr. Chairman. Representative, does this bill also coincide or go along with, is a part of the rural transformation vision that the governor has for the state?
Representative Garrett.
Yes, it is. This is in conjunction with hopefully receiving those funds to eliminate parts of the CON. So yes, it is.
Leader Camper.
Thank you. And you believe that it will allow, increased access to health care in the rural parts of the state?
Leader Garrett.
I absolutely hope it does just that, to make sure our market principles can inspire more access to health care with more choice. Absolutely it does. I hope it does.
Leader Camper.
Thank you, Mr. Chairman. And Representative, in Memphis, Shelby County, Regional 1 is building a beautiful new state-of-the-art hospital there. Would this bill, to your knowledge, have any effect on their ability to continue to do what we need to do in Memphis and Shelby County?
Representative Garrett.
It will not.
Leader Camper.
It will not what?
It will not affect what you're currently doing or what they want to do in the future. It may even give them more opportunities in the future.
Okay, so it wouldn't get in the way of progress that's happening in Shelby County, to your knowledge?
To my knowledge, that's right.
Okay. All right. Thank you, Mr. Chairman. Thank you, Chairman.
Thank you very much. Members, further discussion. Again, we are on House Bill 819. Hearing none and seeing none, are you ready to vote? Madam Clerk, please open the board. All those in favor of House Bill 819, moving on to calendar and rules, please vote aye. Those opposed, please vote no. Has everyone voted? Would anyone like to change their vote? Madam Clerk, please take the vote.
Mr. Chairman, you have 23 ayes, 2 noes.
The ayes do have it. House Bill 819 moves on to calendar and rules.
Thank you, Mr. Chairman and committee.
Thank you. That brings us to item number 7. Item number 7 on our calendar is going to be House Bill 1535 by Representative Shaw. Do we have a motion to second? Motion. We have a motion to second. Sir, you're recognized.
Thank you, Mr. Chairman. I'm carrying this for Representative Shaw, and I stand ready for questions.
All right. Thank you. Members, any discussion on the question? Chairman Vaughn, you're recognized, sir.
Thank you, Mr. Chairman. Is this the Michael Banks wastewater treatment plant naming bill?
It
Representative
is.
Shaw?
Thank you. I
Yes, it
couldn't
is.
pull it up on my dashboard, but let me say this, Mr. Chairman, and to my fellow committee members, I know Michael Banks well, and I can just tell you that no man deserves to have a sewage treatment plant facility named after him as much as my friend Michael Banks does, who has led a renaissance in Haywood County and helped bring back local hospitals, as well as being a member of the Megasite Board. And if for no other reason, we should name a wastewater treatment plant after Michael Banks, because he wears one of the loudest, most putrid shade of orange pants that anyone has ever seen in public. So with that, sir, I'm proud to support this amendment. It should have been done years ago, Representative Shaw.
Thank you. Representative Shaw, you're recognized.
Thank you, Mr. Chairman. I was trying my best not to say a wastewater plant, but thank you.
All right. Any question has been called. Any objection calling the question? Hearing none, seeing none, we're ready to vote. Madam Clerk, please open the board. All those in favor of House Bill 1535, moving on to calendar and rules, please vote yes. All those opposed, please vote no. Has everyone voted? Would anyone like to change your vote? Madam Clerk, take the vote.
Mr. Chairman, you have 27 ayes, 0 noes.
The ayes do have it. House Bill 1535 moves on to calendar and rules. All right, we will now move right on into our presentation. But before we begin our presentation, without objection, we're going to go out of session. We're out of session, and we would like to invite the Department of Finance Administration, Commissioner Jim Bryson, if you would come forward and bring your team with you. Thank you for being here. And just as a reminder, the information is on dashboard, and we will also control your microphone. So once you see it light up red, you'll be ready to go. And I'll just ask, as you begin speaking, if you would just introduce yourself and introduce who you have with you. Thank you very much.
All right. Thank you, Mr. Chairman, members of the committee. I'm Jim Bryson, Commissioner of the Department of Finance and Administration. And I have with me Director David Thurman, Director of the Budget Office, and Assistant Director Alex Schuman over here also. We have a fairly short presentation today. We'll run through this presentation with you and then take whatever questions that you may have about it. So as you can, we have not made any major changes in our, no changes to our growth assumptions. As we discussed in the November Funding Board and the budget presentation in early February, we are in a slow growth environment. The odds of a recession are low, but so are the odds of fast growth. We expect growth, but we expect it to be relatively slow. Most of the available recurring funding was allocated in the initial budget document, and so you will see that this budget amendment relies heavily on non-recurring revenue sources. We're tracking well to our estimate. We are slightly above what we expected, and so we expect to hit our $19.2 billion in general fund taxes and be right at that number. If you see from this chart, we do have a small cushion so that if things slow down a little bit more, we do have a little bit of cushion, but not a lot. We hope to exceed our estimate, but if we do, we're very small, so it will not provide us very much going into your budget for next year, for the next fiscal year. Well, let's get into some of the specifics. So let's talk about education first. The first thing on our education budget here is to reinvigorate our K-12 school safety grants. Past grants have been distributed on an ADM basis, and we assume that they would continue because we know that the LEAs need that funding. The next is the Imagination Library, which I think you're all very familiar with, and we have funded the inflation on this to keep them at the levels of books that they are currently distributing across the state. They'll be able to continue current services there. We have one program in higher education, and that is for MTSU cybersecurity to create a cybersecurity range partnership to enhance their cybersecurity program so that they can have more of those cybersecurity experts that are needed across the state. As you know, we are facing more and more challenges all the time with cybersecurity, so this is an important program. Next, we'll talk about health and social services. We have about 6 items here that we'll roll through. The first is the Department of Disabilities and Aging, a housing assistance grant. We have $1 million from their reserve here will come from their real estate trust funds to launch a housing assistance project. This is with a West Tennessee housing provider specializing in the development of homes for individuals with disabilities. That provider will match DDA's $1 million investment with $1 million in private funds to develop these homes. All the units will be leased at or below 80% of fair market rent for a minimum of 10 years. We have a couple of items here that we kind of classify as have-tos for TennCare. The first one is intermediate care facilities for the IDD individuals. These tie to facility rates that are set by the comptroller's review of actual costs, and this is a required item that we have to do. The second one from TennCare is also another required item. These are for rural health clinics, $20 million. This designation is a federally determined and requires reimbursement at 100% of cost rather than at negotiated rates. These costs are set by the federal, reimbursement rates are set by the federal government. And the reason for the increase is because we have seen dramatic increases in the number of rural health clinics across the state that qualify. In 2020, we had 140 of these clinics, and today we have 304 in 2025. The next one is Health Facilities Commission. We have staffing from the reserves. This is a situation where CMS has asked states to allocate at least 35% of their available civil money penalty funds to a staffing campaign. Tennessee has about $16 million available in CMP funds. So CMS is asking Tennessee to commit a minimum of $5.7 million to this effort from these reserves. Next is the Tennessee Strong Family Pregnancy Center grants that we have talked about in the past. This is a $10 million infusion into these funds that will be used because these funds have been spent down, and this goes back toward those centers. And finally, on this page is a funding for stillborn children. These are women whose pregnancies have ended in stillbirth and this is for the purpose of offsetting burial and disposition costs of the child's remains. We'll talk about safety for just a moment. The first item here is $9.7 million for the Tennessee State Safe Initiative. This initiative is a comprehensive statewide public safety effort to unify the capabilities of local, state, and federal law enforcement partners under a single strategically guided task force. Tennessee Safe will operate across every corner of this state, ensuring that all Tennessee law enforcement benefits from consistent strategy, rapid deployment, and shared investigative resources. Next, we are reinvigorating the House of Worship grants that we did a few years ago, and this funding would continue to support security measures in local communities across the state. The Tennessee Correctional Institute provides training and inspections of local corrections facilities. This item reflects a bit of a restructure to continue and improve the training efforts that are ongoing within TCI by adding 3 positions to better coordinate and execute this program. There is no new cost to this effort. And finally, we have OCJP, the Office of Criminal Justice Programs, evidence-based programming. This is to continue an existing program that was funded with non-recurring funds in the past to help operate local jails that house Department of Corrections inmates and support those evidence-based programs that are similar to the programs that are available in our state corrections institutions. Finally, we have some technology items on here. Lab Services Information System for $2.2 million. This is non-recurring funding to support a new system. The current system will be sunset in December of 2026, so this year. This new system would enhance the efficiency, data accuracy, capacity, and turnaround time, as well as reduce errors in the lab systems. It would also make it easier to track samples and lab data as a new state public health laboratory opens in fiscal year 2027. DOHR recruiting software. For many years, we have had the same recruiting software for the state, and this is a new item so that, what we have now is we have people that apply for state jobs, and we have a high drop-off rate because the technology is very much out of date. People get frustrated with and they drop off. So this is something they've been asking for a while, but it is a new recruiting software that will decrease the abandon rate and help us to hire our state employees much better and give them a much better experience in their first interaction with the state of Tennessee. We have user acceptance testing for DHS also on here. This would support 4 quarterly release updates in the benefits system in FY27, driven by efforts to improve compliance and payment accuracy. What we're really working toward is to improve the workflow and reduce our SNAP error rates. This supports SNAP, but it also supports TANF and ADA as well. And then customer-facing AI also for DHS. These are two items. The first one is to improve the call center services to make the people that call into our DHS call center to give them much lower wait times, much better service, and a much better experience. And the second is digital AI that will improve the self-service support on our web pages and help people to find what they need without having to know where they need to go to get it. The AI will help them navigate those web pages. And finally, we have the quantum infrastructure. We've added $23 million. If you remember, we had $20 million in the base budget or in the original budget this year for quantum network. And this is an additional $23,000 to finish out the network to connect Chattanooga and the University of Tennessee, Knoxville on a quantum network. And it will help keep Tennessee at the forefront of this new technology going forward, and for both technology, education, and economic development. We have a few capital and infrastructure items. The first is a bridge reconstruction in Montgomery County. This is related to some of the economic development that's going on up there. The federal government has designated the bridge that is necessary to serve this facility as not in compliance. So this is to repair that bridge and make that facility, the transportation to that facility and from that facility possible. We also have a update to the Bicentennial Mall right here next to the Capitol. There's a history wall there that shows the entire history of the state of Tennessee, and it has not been updated since it was originally built. And so this is to actually bring it up to date so that future generations will see what has happened in the last 25 years in Tennessee. David Crockett Birthplace State Park. This was the state park in Greene County that was wiped off the map by Hurricane Helene. As you may remember, we had that in the budget and we had federal funds there. We have found that those federal funds are not available as we thought they were. And so we have replaced that with the state funds. The National Civil Rights Museum, that expansion is moving forward, and we want to help with the design, make sure that it is designed in a way that will be that will not only educate our citizens, but also be a tourist draw for people who want to know and see what Tennessee's role in the civil rights movement. And then finally, on this page, we have the Cumberland County utility infrastructure improvements. This will be improvements all around Cumberland County for infrastructure, where there's a lot of growth going on, but the infrastructure is not able to keep up. So overall, we'll look at our total budget. The numbers are all on most categories are very similar to last year. But if you look at the column on the right, the one thing that you will notice is that we're about $5 million less in federal funds. And this is primarily because of federal funds, COVID funds that are being spent and worked out through the system. So that is to be expected. There's nothing surprising there. The only other item that I will mention is that our bonds line. We're down significantly from last year, but that's just because last year we did a lot of bonds for us. This year we're doing the UT Health Sciences Center, and then the rest for about $311 million, and the rest of those dollars are increased bond authorization for TDOT to do more projects across the state with the funding that they have. So that's the presentation that we have today, and I'll be glad to take whatever questions you may have. Thank you, Mr. Chairman.
All right. Thank you, Commissioner. Again, thank you for being here. And members, if you do have questions, please be sure to get on the list as we go through the discussion. I'll begin. So you mentioned growth. Can you talk a little bit about growth? What have we seen so far through this fiscal year 26? And then just talk about what you're seeing moving forward. And as you talk about that, it's hard not to talk about kind of what we're seeing as far as the economy. And so if you want to all put that all together and talk about kind of what we're looking at moving forward.
Oh, the first one. I'm going to let Director Thurman address that. We're on target, but I'll let him address it. Thank you.
Sure. So we're
Director, if you would just identify yourself.
David
please.
Thurman, Legislative Budget, but State Budget Office, sorry. I forget. Years ago. So year-to-date collections, we are tracking a little less than 1% above our estimates, which is good. Little concern that we're starting to see the slowing of sales tax, which is a big part of our revenue growth. I know 1 month does not make a trend, but this past month we had 0.5% growth over last year. So I think we are starting to see that slower growth as we enter into the next fiscal year. But we're right on target to hit our current year estimate.
All right, thank you. And just going to, let's see, it was slide 5. You mentioned the DDA, the housing assistant grants from reserves. Talk a little bit more about that and how much are in their reserves. I'm just curious.
I'm sorry, how much was what again? I'm sorry.
How much are in the reserves? I know you've $1 million for the housing assistance grant. Talk a little bit more about what is actually in that and what is in that.
I can
total
talk just
reserves.
a little bit about that, and while they're looking up how
Great.
much is in the reserve. So this is a grant program. It's a little bit of a pilot where we would build some homes that would house 6 to 8, I believe it's 6 to 8 individuals in each of those homes. That would be, and the homes would be built for individuals with these disabilities, and the individuals would pay less than 80% of market rent. And it would be, I think it's 5 or 6 homes. I don't know exactly, but we could get you that. And the idea is that the DDA would put in $1 million. We would put in $1 million from their reserves. The developer would put in $1 million, and then they would pay the rent to make this work financially.
Yes, sir. You're recognized.
Alex Schuman, Assistant Director of the State Budget Office. Current reserve is about $6 million right now.
All right. Thank you. Can you talk about the shared savings from TennCare? How much are we utilizing in this budget for fiscal year 27 in our budget? TennCare shared savings.
Mr. Chairman, the total, I believe, is $281.8 million. And if you have the sheet that we passed out this morning and that we've delivered to your office, that's on page 6.
Right. Thank you very much. And members, again, that is, again, on page 6. Talk a little bit, though, as we look at the shared savings, and we've utilized those savings in so many different ways throughout the state in the past, especially during, Hurricane Helene and the things we were able to do with shared savings. What do you see moving forward, though? I really get concerned when we start doing a lot of spending and a lot of things we've been able to do. I just don't know what that's going to look like moving forward. And I think it's really important that we really consider that, as the Finance Committee.
Yeah, thank you, Mr. Chairman. The shared savings has been running around $300 million a year over the last few years. Those are all non-recurring dollars because we don't know how long if we will see those year in and year out. And then of course I'm trying to remember the exact year, but there's in about 2030, is it, that our waiver ends, that we get a new waiver?
Around there.
Around 2030. And so that's coming up faster than you want to think. So the shared savings I think is very wise to be careful about them. We can spend those dollars on a non-recurring basis, but we have to be very careful about how we do so.
All right. Thank you. Let's go to the next person on the list. Chairman Williams, you're recognized.
Thank you, Commissioner, and your team. I appreciate, obviously, you give us a 6 or 8 page AA document and you pick the highlights on it. So I'll stick to the highlights here, but I may have some other questions. Tell me about the bridge, Montgomery County. This is the first time I've heard about it. Is it similar to what we experienced maybe in Memphis and we've got to do some emergency repairs? Tell me what's going on there.
So I'll give you what I know about it. It's just recently, in the last 2 or 3 weeks, we've discovered the federal government has determined that bridge doesn't have the weight bearing capacity. It's not in compliance for what we need it for. And we've just discovered that really in the last few weeks. So we've been working to understand what we need to do with that in order to make it work. Because as you know, as you're aware, we have one of our biggest, on the other side of that bridge is one of our largest investments we've ever had in Tennessee history. So we want to make it possible for them to be able to operate there. And that's why we need to fix this bridge, is because the federal government has determined that it's out of compliance.
Well, thank you for that. And Chairman, pardon my indulgence, but so is it a complete bridge replacement or is it a repair to a current bridge?
We'll get you that. I believe it's a replacement, because one of the conversations we've been talking about is whether it's a 2 or 4 lane. I think it's a replacement, but I will confirm that and get it to your office.
Okay, Chairman Hicks' office would be great. The back to the TennCare shared savings. Obviously, through the administrator, through the base budget over the last 3 years, we've created a schedule where we're spending those dollars. What Chairman Hicks was asking about, is this rural health clinics TennCare shared savings spend previously been done in that schedule, or is this new to the schedule and this is modifying it in the AA to put it in?
So we modified to put it in the AH because we needed to fund it in this budget. What we would recommend is that next year it be put in the recurring budget in order to move forward.
Okay. I love it when people make suggestions about putting some recurring as they're walking out the door, but I love that. I guess my question to that is so what did you change something in the schedule to make room for this, or did you steal from out years, a commitment to out years?
No, these were funding that we had in the rural health initiative that we already had there, and this is a rural health issue, and so it matches the purpose of that fund.
Right. One of the other things I noticed in the AA was that there was a reduction of the capital from $125 million for rural healthcare centers because the Rural Transformation Act didn't include healthcare. Did I see that right? It was a reduction from 125 million to 104 and some odd change.
That's because of this change right here.
Okay, so you took that money and put it here.
That's correct.
So that money didn't come necessarily from shared savings. It just came from an allocation, because that
It's from an
original
allocation of shared savings. Correct.
Okay. I did have one other question, just trying to get to it real quick. I do think it's important for the members to know, you kind of broached over it a little bit in the very end. This is a 9.1% reduction in the total base budget over last year. I think it's interesting that we know this. We have lots of discussions. Oh, the state's flush with cash. The interesting part is we're finally working through all the ARPA, ESSER, all these federal dollars, and now those monies we're not carrying on the balance sheet anymore. So it's kind of a return to normal in a lot of ways. I think it's really important that we see that, because as we go forward, particularly with last month's growth, we're expecting 2%. So because we were flat last month, we really got to make up the 2% next month for what we were short the previous month, even though we're pretty much balanced, because it's something we definitely need to look at, particularly as we close out the year. I think it's really important to do that. But as this money continues to wane, this federal money continues to wane, what do you expect if all that money were vacated out of the system now? What do you estimate that number might be?
I don't have that number right now, but we could try to come up with what that is. I think what's going to happen is there are federal dollars that are affiliated to certain programs. You mentioned ARPA is a really good example, that are to certain programs. As those monies get spent, some of those programs, they will come to us and want to continue. Our policy is we don't do that except in special cases. And then there are a lot of programs that this money that are also for capital or infrastructure or something like that. Those projects will come to an end, and then we will just move on. What's interesting about this chart is that if you look at the pieces that are state pieces, generally they're staying pretty constant, especially the top line, which are state taxes that come in. That's pretty constant and pretty level, which that funds most of our state programs. So we are continuing to stay fairly level, maybe increase just a little bit on our state programs. But your point is well taken and absolutely correct that we have to be really aware of what's going on with all of these funds, but particularly those federal funds as they begin to tail off.
Right. Thank you. I'll let somebody else ask the question. I got a couple more. We got time.
Okay. Next on the list, it's going to be Chairman Hawk. And if you're wondering, that glow down there is from Chairman Hawk. It's not the top of his head. It's because of the fact that you mentioned the Davy Crockett, that project over there at $27 million. That's the glow that you see. With that, Chairman Hawk, take it away.
The comment we mentioned on the House floor, be always sure you're right, then go ahead, is Davy Crockett's motto. So thank you very much, Chairman. And thanks for bringing that up, and thank you for that. Couple different points. Number one, I want to point out to our colleagues on page 1 of the schedule, line 5, the Treasury earnings, nearly $141 million. That's substantial when we look at what we're able to do as a state when many other states are in the opposite direction on that fund right there. So I want to recognize that for my colleagues. Before I go into some transportation issues, I want to talk about a little bit about what Chairman Williams was discussing. The drawdown on the rural transformation funds. I'm hearing that we're guaranteed a certain figure, and if legislation goes forward, there may be another additional figure that comes down. What is the expectation with this amendment and with the prior budget document that we'll draw down in the 27 budget for rural health transformation? That may be for David.
For this fiscal year?
Yes, for
So
the
I
budget
think-
we're working on now.
Yeah, so I think it's 206 million per year for 5 years.
Oh, just the federal.
And are we spending that and we're expecting that's going to be the full amount we receive?
I think that's what we've been approved. We applied and we have been approved for.
Yeah, that's how I understand it. We will receive 207 or 206, 207 this year. And my understanding is if we do the things that we told them we would do, that we should receive that over 5 years.
Okay, and my thought is just with the bill we dealt with earlier in this committee, that's part of that conversation, so.
That's my understanding.
Okay, all right, thank you. And as we're going to, now, a bit about transportation, I will go down that road. The prior budget document, nothing in the amendment that you're presenting now, but I certainly would like to see a conversation within this committee and subcommittee and folks who are having the discussion to create a more robust recurring nature of that transportation funding. I know we've got $400 million in the base budget, the original budget, non-recurring for transportation needs. Would love to see us be able to tie that somehow, some way with sales tax revenue and create a natural index for transportation needs in a robust way, recurring and indexed as well. I do want to ask about our another transportation issue, and this may be in the weeds for you all. We may go down the line with TDOT, but we had funded, or at least we have funded in the past 4 or 5 years, our short line railroads with $20 million. There was thought that we could do that again in this upcoming budget. Want to see if that's still in the thought process. I know the Senate had been discussing that in the House as well. Any thoughts on that, Commissioner?
Yeah, we talk to the short line railroads every year. They provide a really valuable service to our state because they go places a lot of other heavy transportation needs don't go. And very important. We talk to them every year. It's something that we want to support. It's just something that in this budget, we weren't able to do.
Thank you, Chairman.
All right, thank you. Next on the list, Representative Parkinson, you're recognized.
Thank you, Mr. Chair. Let me go back to it. The Tennessee Strong Families, can you explain to us exactly what that is?
Mm-hmm. What page is that on?
I had it on my page here, and I can give you a page number if I can.
Yeah, I wanted to make sure I had the name with what it does, and I was right. So thank you, Representative Parkinson. That is for these crisis pregnancy centers across the state. It's a grant program that will go to those centers, and it's going to be similar to the grant program that you all approved 2 or 3 years ago, I believe. This is to fund that once again.
Okay. And just a quick follow-up with the, with this additional, portion of the budget, how much with this added to the initial budget from the governor, how much room does that leave the legislature to, add to the budget?
What do we have?
So in the budget, we have a total of 8, 3 recurring and 5 non-recurring. Of course, you can do whatever you want.
I'm sorry, I could barely hear you, and I'm sure if I couldn't hear you, they
Sorry.
couldn't hear you also.
In the budget, there's 3 million recurring and 5 non-recurring, total of 8.
So I'm sorry. So out of our total budget, what's the total on the budget this year proposed?
58 billion, is that what you're talking about, this number?
Right, yes. 58 billion. Out of that, y'all left the legislature 8 million recurring, 3 million recurring and another 5 million.
We left the legislature what we usually leave because of the relationship that we have with the legislature and how we work. I mean, we do that all. That's the way we usually do.
Gotcha. That's a great relationship. Okay. All right. Thank you. I just want to make sure I was clear on that. Thank you so much.
All right, next on the list, let's go to Leader Lamberth. You're recognized.
Thank you, Mr. Chairman and Commissioner. I think what you're trying to say that the legislative portion of this budget is $58.2 billion because it is this legislature that has to vote on and make a determination as to whether or not to pass the proposal from the governor's office, which we deeply appreciate you working so hard on. But I think that might have been what my friend from Shelby County was getting at, is that it's $58.2 billion. All right. Thank you, Mr. Chairman.
All right, thank you. Next on the list, Representative Miller, you're recognized.
Thank you, Mr. Chairman. Commissioner, I'm on the administration budget amendment overview. Just out of curiosity, I see where an additional $1.7 million is appropriated for the school's audit.
Oh.
How much taxpayer dollars have we invested or are we spending on this audit up to date?
I'm not sure of the answer to that. We can get you that. What this is 1.7 million is to, there's an audit of the Shelby County Schools, I believe it's Shelby County Schools, that's going on now. And this is to help continue to finish that audit, get it finished. That's what this is for.
So we do not know exactly how much we currently
Well,
have spent.
we can get that for you. I just don't have that information with me today.
I think, and I could be wrong, I think we're at $3 million currently.
Okay.
If we budget this, we'll be at 4.7. And then someone said, I think even the comptroller may have indicated that it could go to $6 million. Would you have any idea of why is it costing this amount of money, taxpayer dollars, to do an audit?
Well, I'm not an auditor and I'm not an accountant, so I don't know all of that. I can tell you that it is a big, complicated audit. It's a big system and a complicated system. So I'm sure it takes a lot of time and a lot of people to go through that and to do that. Other than that, I can't tell you. I don't have any information that is going to that there is an additional cost, and we sure don't have anything additionally in this budget.
Okay. Thank you, Commissioner, for that. Thank you, Mr. Chairman.
Thank you. And if I'm not mistaken, I think that total audit, of course, that number is continuing to go up. I think we started out at 6 million and then the request is 1.7, just to get for accuracy. Let's go to Chairman Bond. Chairman Bond, you're recognized.
Thank you, Mr. Chairman. And Commissioner, I'm just curious, we see all these big numbers and I get numb to them. You know, we've got more than $250 million going to UTCHS or HCS, whatever the acronym is. Now we see another almost $250 million going for another initiative there. But $12.5 million for a history wall that's going to be updated for 5 years. What in the world is that thing going to do, and what's it going to look like, and how is it evaluated that that's a good investment of our how can we think ourselves to be good stewards whenever we're going to spend $12.5 million for adding a 5-year period to a history wall? Could you share some with that? This is, as you can tell, it's just cold. It's hitting me cold turkey. And that's the thing that jumps out at me almost the most here.
Be glad to. Thank you. So I'll just give you my perception of this. So the history wall is at Bicentennial Mall State Park, which is the park that actually is right here on the Capitol grounds practically, and it is a place where a lot of people go to learn about Tennessee history because it is the entire history on the wall. I think it's about 25 years. I don't
25,
believe.
okay.
Yeah, I don't believe it has been updated since that park was finished, and so I think it's about 25 years that it would be updated. The cost is the cost that was given to us to do this. We looked at it before and decided that this was the time to do it prior to this administration leaving.
Chairman Vaughn.
So I assume these are etched either granite or marble panels. Is that what it is that we're looking at?
I believe they're black granite. I believe I'm not a rock expert, but it's a black rock wall.
You're talking to a non-rock expert
I've
as
been
well.
called
So-
a box of rocks, but that's about it.
Okay. All right then. Well, thank you for that.
All right. Thank you.
All right. Thank you. Chairman Hill, you're recognized.
Thank you, Chairman. Thank you, Commissioner Bryson. First of all, on the K through 12 safety grants, are those, and I know we've done those the last few years, so is that a first come, first serve? Is that, what is that going to look
That's
like,
attendance, right?
Commissioner?
Yeah, it's going to go out to LEAs based on their student population.
Based on population? Okay, all right. And then I've got another question, if I can, Chairman. On the funding for stillborn children, can you kind of tell me a little bit about that?
It's a relatively small item, and I'm not exactly sure at this point, Representative Hale, but let me get you that information to you. I'll get that to your office, please, if you don't mind.
All right.
Happy
Thank
to give you more details.
Okay. And then the worship grants, how are they as far as the application process and that?
Yeah, we've done those before, and so this is just going to be to renew that. But they are grants that come from the houses of worship that come in, and they are scored, and then they will be granted to those based on their scores. We've just seen a lot of uptick in discussions and concern around that in the last few months, and we felt like this was something important to put back in the budget.
Okay. Thank you. Appreciate it, Commissioner. Thank you, Chairman.
Thank you. Next on the list, Representative Shaw, you're recognized.
Thank you, Mr. Chairman. Along that line, because I had a pastor last time applied for one of the grants, and I think maybe he was late. So when is the proper time to apply for those grants?
I don't know, but Representative Shaw, I will make sure you get that timeline.
I appreciate that because
My pleasure.
he really wants to apply, and I want to make sure I give him the right information.
Well, we want him to apply, so we'll make sure we get you that.
Thank you, sir.
Thank you.
All right. Thank you. Let's go back to Chairman Williams for follow-up. Chairman Williams, you're recognized.
Thank you. Thank you, Commissioner. Just wondered if you could add a little color, maybe send Chairman Hicks' office a little data. Last year, 3 years ago, we issued some bond debt for the Titan Stadium. We issued a little bit last year as well. Is the number as far as the debt service on those bonds still around 11%, generally speaking?
For the ones that have been not issued, yes, still around 11%. But if they've been authorized, we'll true that up in the future budgets.
Is it a big divergence, or is that generally the rule? I know it's dependent upon the rate, and so when the rates are,
I'm not sure how big of a difference, but it is less than 11% because we always have some true up savings there. And 11% is really kind of a safeguard provision to make sure that we don't get caught in a negative position. So
Right.
I just don't know how big of a gap that is.
I think we had this discussion in the original budget presentation, but you know, it seems this seems like the first time we've issued bond. We're issuing bonds, and we're still spending non-recurring money on capital projects. And I guess just to clear it up for the members, were you at all concerned about issuing bonds, which is why you only issued bonds for one project, or because I think if I'm not correct, this administration leaving, their total indebtedness is less than what it was when you came in. If you could speak to that, that would be great.
Yeah, that's correct. We have issued some debt, as you mentioned, over the last few years, but we are still paying off debt and moving on from it. One of the reasons why we don't have a lot of bond debt in this budget is because of the recurring costs. We don't have much in the way of recurring revenues. So if we put, let's take the $300 million one that we do have a bond in here for, 11% of that means we have to reserve $33 million in recurring to be able to do that. And that makes it difficult, especially if you go to $1 billion like we did last year. You have to have over $100 million in recurring dollars to be able to service that debt. So it's a constraint. It's a smart move, but it is a constraint.
Right. And so the reason why is because it wasn't necessarily because of our ability to issue debt as much as it was our ability to fund that recurring revenue. And so if there were a recurring revenue stream that, the legislature passed a bill and it generated revenue, then you wouldn't have as much concern going forward. You wouldn't have as much concern about issuing continued debt and freeing up some non-recurring revenue.
I still want to be conservative about it, but yes, we have bond capacity that we could use if we had the recurring revenue.
Right. Back up a little bit. This administration has made phenomenal investments in roads. Obviously, we're falling a little bit. I hoped that we would see more or do more, obviously, as it relates to roads, particularly the recurring revenue that we did this year. It seems to be, is that more of a placeholder for the tire issues, or is it separate altogether? Was there a purpose for it other than just trying to increase the recurring revenue?
Yeah, thank you. We did the tire. You all did the tire revenue last year. This year, what we wanted to do was we wanted to kind of break the seal on using general fund recurring revenue for roads and be able to do that. We've got to solve this problem, as Chairman Hawk talked about a minute ago. And so we've just got to move forward. And the $25 million in the original budget is not nearly what we'd like to do, but it does break the seal on moving forward, and we can do that.
Thank you. Thank you, Commissioner.
Can you talk a little bit about it's in your slide, your TBI Safe initiative. 6.7, I guess, was for fiscal year 26, which was what we're currently in. So are you updating that now? So you got $3 million in the AA going to that. So that's what gets that up to 9.7. Or are you saying 9.7 for fiscal year 26 and 7? Or is that one time? Help me understand that funding.
You want to explain that? You do that. Thank you. I'm going to let Director Thurman deal with that.
So I guess I would look at those as two separate adjustments. The $3 million supplemental to the current fiscal year is to help cover current year costs regarding overtime, lodging, food for that specific initiative. The 9.7 is a recurring funds, some non-recurring, to help add additional positions to support a statewide initiative for this. So similar but different.
Okay. And just for the committee, what are some of those initiatives that we're covering on these? So let me make sure I've got it right. You tell me if this is correct. So it'd be for like intelligence analysts, cyber data positions, and law enforcement support staff. Is that going into pilot programs?
Yeah, TBI is going to add 32 positions across the state to help coordinate with local, state, and federal law enforcement to be able to provide training and information on that they kind of help coordinate so that, a few years ago we did the network, the communications network, try to help everybody coordinate. This is an initiative from my TBI to try to help coordinate the people on the local law enforcement side so that we can have a better law enforcement community across the board.
Okay. Thank you, Commissioner. Let's go back for a follow-up with Representative Miller. You're recognized, sir.
Thank you, Mr. Chairman. Commissioner, just looking at the rainy day fund 10-care reserve, And looking at 26, 27, we started 2.205 billion. And then the total with the TennCare reserve is, what, 3.6 billion? Are we making any monies off of those reserves? And should there be another category? Or is that, let me know how this is working out from the standpoint of interest bearing.
The rainy day fund, a lot of these federal funds that we have where we're showing we're spending them down over time, all of those are in the treasurer's office, and the treasurer actually invests those funds and manages them. And that's where we get the $140 million that we outlined in here for treasurer's earnings. That's the interest off of those funds.
Thank you, sir.
Sure.
All right, members, I have no one else on the list. So Commissioner, thank you. Thank you for being here. Thank you and your team for what you do, and you're recognized.
Thank you, Mr. Chairman. Members of the committee, I want to thank you for having us here. I want to thank you for the questions. I just wanted to say a couple of words, because most likely this is the last time that I will appear before you as a group. I'm sure we'll be talking individually, but maybe the last time I talk to you as a group. It has been a great honor and a privilege to work with you and to serve the state of Tennessee. I've had the great good fortune to serve in both the legislative and the executive branches of state government, and both have been tremendously rewarding. This is my fourth budget as F&A Commissioner. When I began, some of your colleagues said that I wouldn't last 2 years. Well, I beat that, and I'm glad to know that. For these 4 years, you've treated with me with respect, even when we disagreed. Thank you for that, and I will always be grateful. Working with this General Assembly on behalf of the state of Tennessee is something I will treasure for the rest of my life. This has been an extraordinary time. Together, we have made unprecedented investments in important government functions such as education, infrastructure, public safety, state parks, capital, and maintenance, among others. Yet Tennessee remains one of the best managed states in the nation and is one of only 14 states with a AAA bond rating. I like to think that we had something to do with that. As a Tennessee citizen and as a public servant, I thank you for ensuring that our state will always be well managed and fiscally sound. Finally, I want to say thank you to the amazing budget team that I get to work with. They are simply the very best in the nation. They have taught me so very much, and we have had a lot of fun together. I can't tell you enough. Most of them are sitting right back here. And I'm very, 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 very proud of them. Happy to work with them. Mr. Chairman, thank you for giving me a moment to express my heartfelt appreciation to you, particularly, but also to the committee for all that you have done for me and for my team over the last 4 years. Thank you very much.
Commissioner, I know we still got more work to do as we finish up this session and certainly get this budget across the finish line. But I do want to say thank you and your team and your staff for all the hard work that you guys have put not only into this budget, but for every budget that we've worked on that I've been a part of for the past several years. So I want to say thank you, and I really appreciate, again, all that you all do for the state of Tennessee. And you all have played an integral part in the great success that we see today and hopefully for the upcoming year. So thank you all again. Members, without objection, we're going to go back into session. We're back into session, and Chairman Grills, you're recognized.
Thank you, Mr. Chairman. And just a point of privilege here, we did not introduce Ms. Holly Zachary driving all the way from Knoxville to come visit with us today. So I want to let her know that we really appreciate you coming and sitting in with us.
I saw her sitting back there, but I wasn't about to embarrass her or anything, so I wouldn't dare do that, Rusty.
I wouldn't either,
probably
sir.
in trouble. All right, anything else come before the good of the committee? Hearing none and seeing none, without objection, we stand adjourned. We're adjourned.